The Worth stands for Women's Organization for Reproductive and Total Health Care, and we provide all women's health care services.
It's a clinic to meet needs for women's health care here in Rome and Floyd County, though we actually have clients who come from outside of Floyd County. The need is so great.
We are the only nonprofit women's health care for many counties surrounding us. We get people that come up here even from Atlanta that can't find an affordable colposcopy if their pap smear is abnormal. So we started it because I was seeing so many uninsured women that weren't getting any health care at all. And I've worked in women's health care in this area since 1987. And they're still uninsured 20 years later. Women in Georgia just do not have access to affordable health care. And about 20% of women in Georgia are uninsured. And even the women that have insurance can't afford health care because their deductibles are so high and their co-pays are so high. So women are going without preventative health care screening. But if you don't support women's health care, women will die from cervical cancer and breast cancers.
Because of a lot of women's health care issues are related to sex and STDs, I think that the public kind of shies away from it, and you know, it's like a no-no to have cervical cancer because you got it through sexual intercourse.
Nobody wants to think, oh my gosh, women have vaginas, you know, and a whole system of organs that need to be taken care of too, you know, and for some reason people just don't want to talk about it. It's almost like a worldview that these issues are not important. And in order to change that and to provide more services, more effective services to more women, people need to know that these are issues. This is a dangerous, you know, these are dangerous things. Women die because of lack of access to preventative health care.
Just in the last 2 years, the number of uninsured working people here in the state of Georgia has gone up by 3%. That means that a lot of preventive services, or in the case of women, they're not sort of regular health care that they need, family planning services are not available to them.
When I first started working, I thought it would be more like, I thought most of our patients would be younger women looking for birth control and STD testing, and I was really surprised at the number of middle-aged women who came in with major gynecological problems, who didn't have access to any other kind of health care. They could not afford it anywhere else. If this clinic had not been here, they would be left untreated. I've seen a lot of women have beginning stages of cervical cancer, which I didn't expect to see, because cervical cancer is 100% preventable. If you can get a pap smear every 2 years, then you can keep checking for that. But some women haven't had paps in 10 years and have come here to get a pap smear and a follow-up, and it's too late.
We have more doctors per capita in this county and more healthcare facilities than any place in Georgia. And our people cannot get health care in this county, and we just have to change that.
We've had a lot of women call from the health department here saying that the health department is trying to charge $200 for STD testing or for a abnormal pap, a follow-up, and they just can't afford that there. And so this is the only place that they can come to.
A lot of women don't know that every health department in Georgia has pap smear access available. And they also don't know that the health departments are required to provide that service based on income. So our health departments aren't telling our women that. So when they call the health department, they're told it's going to be $150, and of course the woman just hangs up. She can't make that kind of appointment. So we're trying to educate people that the health departments are required to provide that service. That's why we decided to start doing this healthcare access guide that we're going to publish. We've got a whole notebook, and this is also on our website, for women that are uninsured in Floyd County, of men and women both. How to get Medicaid, how to apply for the county clinic, how to access the free clinics, even information about how to negotiate healthcare costs. Like if somebody has to go to the emergency room, if they're uninsured or poor, they may not have to pay for that under some federal guidelines. So we're trying to give people information about how to access healthcare.
Marilyn does pap smears and colposcopies, abnormal follow-up, STD testing. She has every kind of birth control, from the pill to the depot shot to an IUD. She can do STD treatment, and also checking your cholesterol and blood lipid levels, things like that. It's mainly all preventative health care.
The services here are, scaled down to a cost that is so low compared to even the health department, which is supposed to be, scaled down to nothing if that's, what a patient needs. The cost of services here is affordable by comparison. It's sad that even some women can't even afford to pay for services here. We need funding. We need to be able to pay a staff. Right now the clinic is completely operated on a volunteer basis. No one gets paid. And everyone who works here does so because they are passionate.
We're always happy to have donations. We can use in-kind donations, some office equipment. If you've got a spare computer, we can always use that. If you're in the medical industry and you have spare equipment, Marilyn can often use that if it's the right thing.
We had one of our local businessmen last month gave us $100, saw the article in the paper about the pap smear issue, and he sent over $100 to screen some women. And we were able to do 3 pap smears for women with that $100. All 3 of the women came back with abnormal pap smears that need medical follow-up. And they would not have been found if he had not donated that $100.
The best thing the community could do is realize that these are issues, they do need to be addressed, and that women's bodies and addressing women's healthcare needs is not bad. It doesn't make you anything but responsible and caring and accepting.
As far as impact of the clinic, we have well over 300 patients now. And we've had a number of abnormalities that we found that would not have been found if we hadn't been here. So we've definitely made an impact.